Hello friends, welcome to New Roots. Today we are with a new topic of hypertension. Unknown hypertensive patients came across to us for requirement of a transplant. Now, why certain blood tests, certain investigations are important while we are going for a transplant? There are many patients who approach us who are willing to do transplant, and we advise them to do certain prerequisites, certain pre-preparations before going for the procedure, which includes certain blood investigations, certain blood pressure issues should be normal. Now, this sir approached us. He's just 27 years old. He came to us with the requirement of a hair transplant. He had a grade 5A hair, male pattern thinning or male pattern baldness. His requirement was 5,000 grams to cover the area. But when he approached to the clinic, we figured out that he's having hypertension. After taking 2 to 3 readings in supine condition, sitting condition, after 1 hour of the condition, things seems to be like with no history and with a 27 age, being hypertensive was really very difficult to digest. So we gave him time. We asked him to meet the physicians, to rectify himself, but then the issue was he didn't have that much time to go ahead and get the proper treatment done with it. So taking utmost precautions, giving him short-term antihypertensive medicines, making our OD prepared for these kind of patients is very important before we take the patient for the procedure. So 15 days prior, we started with this treatment, and then we gave him certain antihypertensives. We gave him beta blockers. We stabilized his blood pressure. We saw that all his blood investigations, his bleeding time, clotting time, other investigations were done. And when everything was normal, only then we posted him for the procedure. On the procedure day, because of stress, because of anxiety, again the blood pressure was little shooted up. And then taking the right decision, right call, we divided the same day patient or same day case into 2 days, and we converted the case into a mega session. When the patient goes for a mega session, the patient is also at ease. The patient doesn't have to undergo with too long time of stress during the time of operate. The oozing is also under control, and then the procedure goes on very smoothly. We can see that almost 5,000 grafts of the patient has been implanted. There was no kind of emergency, or there was none of the any kind of complication which came across. Obviously, we have a standby anesthetist also, but with God's grace, there is no such emergency when we have to go on. But all world and organization protocols are followed in New Roots, and taking into consideration anyone who's looking for a transplant, please go ahead with your physical fitness first, which is very important before we take you for the procedure. Though it is a local anesthetic procedure, it's not a proper operate, it's a procedure. But then unless and until you are fit for the procedure, you should never go ahead and you should never take a call for opting. As आपल्याला 5 महिने झाले ट्रान्सप्लांट करून, बरोबर? तर तुमचा एक्सपिरियन्स कसा होता?
सो माझं आता तुम्ही बघताय की 5 मंथ ट्रान्सप्लांट झालेले आहे आणि टोटल ओव्हरऑल रिझल्ट सॅटिस्फॅक्टरी आहे. आणि मेन मुद्द्याचं असं की मला हे ब्लड प्रेशर होता, त्यांनी डॉक्टरने चांगलं फॉलोअप केलं, रेग्युलरली फॉलोअप घेतला आणि ओव्हरऑल चांगले रिझल्ट, चांगले न्यू रूट्स. थँक्यू.
So friends, anyone who is looking for a transplant, who is having a history of hypertension or who is not having a history of hypertension, with unknown history also, you come down, you will be properly treated, and then only we can take you for the procedure. For any queries, you can get back to us at Canada Corner, Kuruvilla House, Nashik, New Roots. Thank you.